Normally, your general dentist will refer you to an implant dentist that they work with. But we have found over the number of years that we've been placing implants that some patients want to find somebody that they want to work specifically with. So they use the internet to access this information, and then we're in a situation where we have access to so much information now on the internet. So we have patients that access independent testimonial sites such as Google reviews. And when you have found the right clinician to do your own dental implants, it is essential that you check their qualifications and their experience, as well as the skills that they have gained over the number of years. Dental implant treatment can be relatively simple in some situations, but in a good number of situations it can be quite complicated. So it is essential that clinician can reconstruct the bone so that your implant can be precisely and accurately placed within the bone without damaging any of the nerves or any of the structures that could lead to further problems. Some implant dentists will have 3D CT scans within their practices, and this will allow that clinician to keep all the workflow of the treatment in-house, so then you don't have to be referred elsewhere for complex 3D imaging to be taken for your therapy. I feel that one of the most important things as a patient is that you need to be able to have good rapport with that clinician who's going to be doing your implants for you. Some of the implant treatment can take 3 months and can, in some complicated situations, can take up to 18 months. So you need to have a relationship, an open relationship, where you can both say what you need to, so that you can both achieve the goals that you wish as a patient. As a periodontal specialist and an implant dentist, I myself, when I see my own patients, I use my cone beam CT to assess how good the quality of the bone is and if there's sufficient bone for the placement of an implant, so that I can avoid any of the dangerous structures that could cause problems for a patient in the future. I can also precisely plan how to reconstruct the bone to accommodate your dental implants so that we will have long-term success for you. So here within the practice we utilize the latest technology by using our CT scanner to assess the bone that you have, and from that we can then generate a virtual image to plan your implant placement within the computer model. And as a consequence, we can then avoid any mistakes or any deviation from the plan. We also have a 3D intraoral scanner which will avoid impression techniques, so that we can then construct, again, your custom-made crown from a 3D printed model. Things are just moving on very quickly within implant dentistry, and it is important that your clinician and me as your clinician will be at that cutting edge.